So we're going to start off now with who can do this. Because we're having a lot of discussion right now. 10, 20 years ago, the discussion was more between SLPs versus OTs, who can do it. And these days I'm seeing the discussion between, okay, how much can a lactation consultant do? And we're going to talk about it. All right. So, what allows you, as someone sitting in this room or watching this, to treat feeding disorders? It's usually the scope of practice that's delineated by your professional practice group. So starting with SLPs, because I am one, the ASHA scope of practice in 2007 was delineated for us that we can look at and assess and treat feeding and swallowing. What does that encompass? Oral, pharyngeal, laryngeal, and esophageal. Whoa, circle that one. And esophageal issues.
Good luck with that.
Yes, good luck with that. How many of you, if you even had a course, got to look at the esophagus? I can remember specifically being told, the esophagus, that's GI. That's theirs. We don't look below the neck. I've been told that many times. But now, ASHA, as far back as 2007, said, nope, esophageal is in here too. Can problems in the esophagus affect feeding and swallowing?
Yeah.
Have you gotten a piece of meat stuck in your esophagus? Anybody dealing with reflux? Ah, yeah, it can affect it, can't it? Now, I do also want to say, I'm speaking about ASHA because I am in the U.S. and because I'm not trying to sound arrogant, but a lot of the professional practice groups in other countries will follow ASHA's lead. So that's where I'm going to speak from. But you need to look at your individual country or province and what they say. The ASHA practice portal, which by the way, if you have not gone on there and looked at the practice portal stuff, it is amazing. I mean, ASHA has done a fantastic job. There is good information on there. And there's the text coming through.
I have somebody asking to review these parts. Does that make sense?
The word, okay, that we, in feeding and swallowing, the person who asked, is this what you meant? Otherwise I'll go back. That in feeding and swallowing, ASHA has delineated that we look at oral, pharyngeal, laryngeal, and esophageal areas. So that is very different from what it used to be when they actually said, no, we don't do esophageal. So that has changed. And if that wasn't it, tell Sharon. Okay, in the ASHA practice portal, it also says in there, speech-language pathologists play a central role in the assessment, diagnosis, and treatment of infants and children with swallowing and feeding disorders. So ASHA is saying we kind of see SLPs as one of the leads in this area. But you notice that it says a central role. It doesn't say the. Because no one profession can say, we're the main ones, we're the only ones. They can only say, we do this, but they can't keep other people from doing it because they only have authority over those that are in their practice. So that's good in some ways, and that's very frustrating in other ways. So it means that this thing on Facebook that I saw, since it wasn't SLPs who were putting on this course and saying we can take our magic wand and make you a pediatric feeding specialist, they're not SLPs. ASHA can't do anything about it. Okay. I'm on slide 9 or 10 now. OTs. Can they treat? That was a wardrobe malfunction, y'all. Yes. The practice of occupational therapy, this comes from their reference manual, includes management of feeding, eating, and swallowing to enable eating and feeding performance. And they have made the area of dysphagia an advanced practice area. So they get credentialed in this. They have to go on for further training. We do too in a lot of ways, but we don't have it formalized like that. We meaning SLPs in the US. In the OT scope, I just wanted to say that before they had it more formalized, the OTs had it more formalized, they did have a few references to it that I was looking for when I was putting together an interdisciplinary feeding clinic. And I just want to give you this quote that I love from looking at things from their viewpoint. Occupation-centered intervention focuses on the components that enhance the person's ability to participate in eating and feeding activities of daily life that are valued and fulfilling to that person. The art. They're bringing in the art. Such as learning to eat independently. How important is independent eating across the lifespan? Joining friends for lunch. All right? And feeding a child. I think I missed my calling. I think I should have gone into OT. Because a profession that talks really about girls' night out. I am there. Okay? Yes, PTs. Can they? I have not found it formalized in their scope of practice. If I'm wrong, please email me and let me update. But it does include tests and measures that may include the following: neuromotor development and sensory integration. Does that play a part in feeding? Yes. And self-care and home management activities. Is eating an ADL? Yes. I have known PTs that treated feeding and swallowing and even did video fluoroscopy. Here's the deal. Remember, I'm not very territorial. I care, do you know what you're doing? And if you know what you're doing, we need you. Because we've got plenty of kids to go around, don't we? If you work in pediatric dysphagia, you've got job security because there are always kids who need it. So join us. This is an example. One thing, here's what you need to do. In order to help with third-party payer issues, you can't overlap what you're doing. How do you delineate who does what? You sit down and hash it out. There are no hard and fast rules. You sit down as a team and figure it out. And it may be different in different places that you work. One clinic may do it this way, another may do it another way. Do PTs, what could you do for the PT? Or what could the PT do, I should say? Don't we need work on proper positioning?
Yes.
Yeah. Trunk control? That's huge. Head control? We're going to be talking about that. Can they do traditional dysphagia treatment? If they know what they're doing. They were the first, in the US, they were the first therapists in the NICU. We'll skip that one. IBCLCs. Okay, can lactation consultants treat pediatric dysphagia? Now on your handout, this is a blank slide. This is so that you can write this in. In their scope of practice, which I pulled today, because I wanted it to be, be sure we've got the latest and greatest. It says that part of their scope includes performing comprehensive maternal, child, and feeding assessments related to lactation.
So not sippy cups.
So not sippy cups, not bottles,
Lactation
lactation only.
So not like Dr. Brown's nipples.
Not Dr. Brown's nipples, not, you can't send them out in place of the SLP or OT or whatever.
This is a hot button topic
Okay,
on a feeder.
yes, this has been a hot button topic, and I am not meaning to step on toes, but we've got to, everybody keep in your lane, all right? You've got to be careful with this. This is why it takes a team. Now, I love seeing so many professionals getting their IBCLC. We need the information. But guys, there's an equation. Boob plus baby equals good feeding. IBCLCs know a whole lot about the boob part that OTs, PTs, SLPs, whatever, did not get. The only thing that I knew about boobs was from personal experience, okay? I got 2 of them, that's about it, you know? But we know a whole lot about the baby that the IBCLCs did not get in their training. They may get some, or they do get some, but they don't get everything that we're getting. We've got to work together. Now, I don't want to see snooty. I don't want to see fighting. I want to see teamwork. But you got to go back and look at your scope. Otherwise, you can get sued. What are the roles of assistants? Let me summarize. For speech-language pathology assistants, no. Not anything to do with dysphagia. Can they work with kiddos who have sensory issues with feeding, but their swallow is safe? Yes.
Good to know.
Okay.
Okay.
And it's in there.
Okay.
Occupational therapy assistants, what can they do? It's pretty broad. All right. Interventions that are consistent with the OT's demonstrated competency. So there's whatever their supervisor assigns them, as long as their supervisor is competent in it. So the supervisor is the judge of their assistant's competency. PTs, again, under the direction of the physical therapist, and they have to show demonstrated competence. But it's the supervising PT that determines that.
Does our board, state board trump that though?
Does our state board trump that though? Yes, and I think was that on there?
Yeah.
Back there I missed it, yes. Our state practice laws will legally trump any guidelines presented by AOTA, APTA, ASHA, whoever. So this is in the US, you've got to look at what your state practice laws are. Thank you, Cindy.